Hey everyone, and welcome to the Deep Dive. Today we're tackling a topic that a lot of you have been asking about, and that is the pros and cons of different diabetes medications.
Oh, yeah.
So to get ready for this deep dive, you guys sent over a ton of great sources like diabetes and oral medication, the Mayo Clinic's Guide to Diabetes Treatment, medications for type 2 diabetes, and some really insightful pieces from the NIDDK on insulin and other treatments.
Absolutely.
So we're going to unpack all of these sources and hopefully give you guys the info that you need to have some informed conversations with your doctor.
Yes, definitely.
And of course, don't forget to like, share, and subscribe to Visions Beyond.
Yes, please do that.
All right, so let's jump in. Just looking at this stack of research, it can feel kind of overwhelming to navigate all these different meds and treatments.
Yeah, for sure.
Luckily, we've got our expert here with us today who can kind of help make sense of it all, right?
Yes, absolutely. And remember that this is a pretty complex topic, so we're just aiming to give you a solid overview here.
Right.
Not to replace the advice from your own healthcare provider.
Exactly. So before we dive into the specifics of different medications, can we just take a step back and set the stage? What's the big picture when we're talking about diabetes medications?
Sure. So the first thing to remember is that these medications are primarily for type 2 diabetes.
Okay.
And that's where your body doesn't use insulin effectively.
Mm-hmm.
Unlike type 1, which is an autoimmune condition where the body doesn't produce insulin at all.
Right. So type 1 is a whole different ballgame.
Exactly.
And of course, the goal of all these medications that we're talking about is to get that blood sugar down.
Yeah.
To get that A1C number into a healthy range, right?
Precisely. It's all about helping your body regulate glucose.
Okay.
Whether that's by boosting insulin production, improving insulin sensitivity, or even helping your kidneys flush out excess glucose.
Okay, that makes sense. So one medication kept coming up in the research that you guys sent as kind of the star player, metformin.
Yep.
It sounds like it's often the first choice for both type 2 and even gestational diabetes.
It is.
If medication is needed.
If medication is needed, it really is the front runner. And there are good reasons for that.
Yeah. Why is that?
Well, what's fascinating about metformin is it tackles the problem from multiple angles.
Okay.
It reduces the amount of glucose your liver produces while also making your muscle tissue more sensitive to insulin so your body uses it more efficiently.
Oh, wow. Okay. So it's like a double whammy.
Kind of, yeah.
And I saw in one article, too, that it doesn't cause weight gain. It might even help with a little weight loss.
Yeah.
That seems like a huge plus compared to some of the other medications that we'll be talking about.
Definitely a big advantage, but like any medication, it does come with some potential side effects.
Oh, sure.
The most common ones you'll hear about are those gastrointestinal issues,
Uh-huh.
especially when you're first starting out.
Okay.
We're talking diarrhea, upset stomach, and that infamous metallic taste.
Oh, yeah, I've heard about that metallic taste.
Yeah. Not exactly a pleasant bonus.
True. But the good news is those side effects often lessen over time.
Oh, good.
Yeah.
Good to know. Okay, so moving on from metformin, we have a whole array of other medications.
You do?
It seems like finding the right fit really depends a lot on, individual needs and how your body responds.
Exactly. It's not a one-size-fits-all situation.
Right.
So let's look at sulfonylureas, for example.
Okay.
They've been around for a while, and they work by basically kicking your pancreas into gear,
Okay.
making it release more insulin.
So more insulin to help process that sugar?
Exactly. There's a catch.
Okay, what's the catch?
They come with a higher risk of hypoglycemia,
Uh-oh.
and that's when your blood sugar drops too low.
And that can be dangerous, right?
Yes.
I remember reading that severe hypoglycemia can even lead to confusion and loss of consciousness.
Absolutely. It's a serious consideration.
Yeah.
And another downside is that sulfonylureas can lead to weight gain,
Oh.
which isn't ideal for many people with type 2 diabetes. Right.
All right.
Yeah. Definitely something to weigh carefully.
Yeah.
Now, what about meglitinides?
Okay.
They sounded similar to sulfonylureas, but maybe a bit faster acting.
You're right. They also work by stimulating insulin release,
Cool.
but they have a quicker onset and don't last as long in the body.
Mm-hmm.
Think of it like a short burst of insulin rather than a sustained release.
Interesting. And is that why they might be less likely to cause severe hypoglycemia?
It could be a factor, but weight gain is still a potential side effect.
Okay.
So again, it's about finding that right balance of effectiveness and potential downsides.
Right. So pros and cons with every single one.
Exactly.
Okay, cool.
Yeah.
So we've covered metformin, sulfonylureas, and meglitinides.
Right.
It seems like there's a whole like family of these medications with slightly different ways of working.
It really is. It's like a toolbox with different tools for different situations.
I like that analogy. So what other tools do we have in this diabetes management toolbox?
Well, let's talk about DPP-4 inhibitors. They work in a more roundabout way,
Okay.
boosting your body's own natural blood sugar regulation system.
Okay, so less about forcing the pancreas to produce more insulin and more about enhancing what's already there.
Exactly. They do this by increasing the action of a gut hormone called GLP-1,
Okay.
which naturally stimulates insulin production after you eat.
Mm-hmm.
These inhibitors prevent its breakdown so it sticks around longer and can do its job more effectively.
So it's like giving GLP-1 a little boost, helping it work more efficiently.
Yeah, exactly.
So what's the upside of that approach?
Well, a big plus is that they don't cause weight gain and have a low risk of hypoglycemia.
Okay.
But like all medications, there are potential side effects.
Right. I'm seeing a pattern here. No such thing as a free lunch when it comes to medications.
Unfortunately, that's often true with DPP-4 inhibitors. Some people experience headaches or gastrointestinal issues.
Okay.
And in rare cases, there can be more serious risks like pancreatitis or kidney problems.
Okay, so definitely something to discuss with a doctor. Now, there was another class of drugs that caught my attention.
Oh?
SGLT2 inhibitors.
Yes.
They sound pretty unique because they actually work on the kidneys.
They do. It's a completely different approach.
Okay.
Instead of focusing on insulin production or sensitivity, these medications help your kidneys remove excess glucose through your urine.
So it's like creating an escape route for sugar.
Yeah.
Get it out of the bloodstream and into the urine. Pretty clever. But what are the downsides of messing with the kidneys like that?
Well, as you might expect, some of the side effects are related to the urinary tract.
Okay.
Things like UTIs and yeast infections are more common, and there are rare but serious risks, like ketoacidosis, which is a buildup of acids in the blood.
Okay, so again, benefits and risks to consider.
Absolutely. However, it's important to note that SGLT2 inhibitors can be particularly beneficial for people who also have heart or kidney issues.
Oh,
They've been shown to have protective effects in those areas.
so it's not just about managing blood sugar, but also considering the bigger picture of overall health.
Exactly. Diabetes management is multifaceted.
Okay, on to the next one. What about TZDs? How do they work their magic?
TZDs, or thiazolidinediones, take a more behind-the-scenes approach.
Okay.
They increase insulin sensitivity in muscle and fat, making your body more responsive to insulin.
Mm-hmm.
They also reduce the amount of glucose your liver produces.
So they're kind of like those unsung heroes quietly working in the background to improve things.
That's a great way to put it. But there are some downsides.
Okay, what's the catch?
TZDs can cause weight gain and fluid retention, and they're not suitable for everyone,
Okay.
especially those with heart failure, as they can potentially worsen that condition.
Okay, so definitely not for everyone.
Right. It's about finding the right medication for your specific circumstances.
Now, one medication really stood out to me because it seemed like a newer, maybe even a game changer type of drug.
Uh-huh.
Rybelsus.
Yeah.
It's taken orally, but it seems to work a lot like those GLP-1 agonists we talked about earlier.
You're right. Rybelsus is unique because it's the first oral GLP-1 receptor agonist.
Oh, wow.
It basically mimics the effects of that gut hormone GLP-1, but in pill form instead of an injection.
So you get the benefits of a GLP-1 agonist,
Yeah.
but with the convenience of taking a pill.
Exactly. That's why it's generating so much excitement.
Yeah, I can see why.
Rybelsus can help with blood sugar control and weight loss, and it has a lower risk of hypoglycemia.
Sounds promising, but I'm assuming there's a foot coming.
Of course.
Are there side effects with this one, too?
Of course, there are always potential side effects.
Right.
With Rybelsus, the most common ones are nausea and vomiting.
Okay.
And like with DPP-4 inhibitors, there's that rare risk of pancreatitis.
Okay, so another one to discuss carefully with a doctor.
Absolutely. Informed decision-making is key.
Now, before we wrap up this part of our deep dive, there's one more class of medications we should mention.
Okay.
Alpha-glucosidase inhibitors.
Okay.
How do they fit into all of this?
Alpha-glucosidase inhibitors work a bit differently than the others we've discussed.
Okay.
They slow down the breakdown of carbohydrates in your gut, which helps prevent those blood sugar spikes after meals.
So they're like the traffic controllers of the digestive system, slowing down the flow of sugar into the bloodstream.
Exactly. They're especially helpful for people who struggle with post-meal spikes in their blood sugar.
That's great. But are they as effective as some of the other medications we've talked about?
Well, they tend to be less potent than some of the other options, and they can cause some gastrointestinal discomfort.
Oh, like what?
Think gas and bloating.
Okay, so maybe not the first line of defense, but still a tool in the toolbox.
Exactly. And it's important to remember that many people end up taking a combination of medications to achieve optimal blood sugar control.
So it's about finding the right combination that works for your individual needs.
Precisely. And that requires working closely with your doctor and having open and honest conversations about your experiences and concerns.
This has been such a fascinating deep dive into the world of diabetes medications.
It is.
It's amazing how many different approaches there are, each with its own pros and cons.
It really highlights the importance of personalized care.
Right.
What works for one person might not work for another. It's about finding the right fit for you.
Okay, so welcome back to the final part of our deep dive into diabetes medications. We've covered a lot of ground exploring, all these different options,
Right.
each with its own set of benefits and potential downsides.
Yeah.
But now I kind of want to shift gears a little bit and talk about some real world considerations that are just as important as understanding the medications themselves.
Absolutely. It's not just about picking a medication from a list, right? It's about integrating it into your life and your overall health strategy.
Exactly. And one thing that kept coming up in the research that you guys sent was the importance of lifestyle changes.
Oh, for sure.
It's not just about taking a pill. It's about making those healthy choices
Yeah,
that support your body's natural ability to regulate blood sugar.
that's right. Things like diet, exercise, weight management, even stress reduction, they all play a huge role in managing diabetes, regardless of what medications you're on.
Yeah, one article even said that in some cases, especially early on in type 2 diabetes, those lifestyle changes alone might be enough to keep blood sugar levels in check.
It's true.
Yeah.
Medication can be a valuable tool,
Yeah.
but it shouldn't be seen as a replacement for making those healthy choices.
And even if you do need medication, those lifestyle changes can make the medication work even better.
Right.
You might even be able to lower your dose or something.
Exactly. It's all about working with your body, not just relying on medication to do all the heavy lifting.
Okay, so lifestyle is key.
Yeah.
What about the cost of these medications?
Oh,
Let's
yeah.
be real. Diabetes meds can be expensive.
Absolutely.
I know that's a barrier for a lot of people.
It's a significant issue, and it's something you shouldn't be afraid to discuss with your doctor. There might be more affordable options within the same class of medications, or there might be assistance programs available.
I remember one article mentioned that metformin is a relatively inexpensive medication,
It is.
which is one reason it's often the first choice for treatment.
That's right. Affordability is definitely a factor doctors consider.
Yeah.
And as a patient, you should feel empowered to ask about it.
Absolutely. Now, another thing that can get kind of tricky is when you're taking other medications alongside your diabetes meds.
Oh, yeah.
Keeping track of all the potential interactions can be a real headache.
It definitely can. That's why it's crucial to keep a list of all your medications, including over-the-counter drugs and supplements, and to share that list with both your doctor and your pharmacist.
One article highlighted that sulfonylureas and TZDs in particular are known for sometimes having interactions with other drugs.
Right. And those interactions can have serious consequences.
Oh, wow.
From increasing the risk of side effects to making one or both medications less effective.
So clear communication with your healthcare providers is essential.
Absolutely. Your pharmacist is a great resource for this. They're experts on drug interactions and can provide valuable insights.
Now, one question that came to mind as we were discussing all these medications is about pregnancy. How does managing diabetes change when you're expecting?
That's a really important consideration. Managing diabetes during pregnancy is crucial for both the mother's health and the baby's development.
We touched on gestational diabetes earlier,
Right.
but what about women who already have diabetes and then become pregnant?
In those cases, the treatment plan often needs to be adjusted.
Okay.
Metformin is generally considered safe to use during pregnancy, but other medications might need to be changed or switched to insulin.
So again, it's all about working closely with your doctor
Yeah,
to create a plan that's tailored to your specific needs and circumstances.
exactly. Pregnancy brings a lot of hormonal changes, and those changes can impact blood sugar control.
Oh, wow.
So close monitoring and adjustments to the treatment plan are essential.
Okay, so we've talked about lifestyle cost, drug interactions, and pregnancy. What's the big takeaway here? What should our listeners keep in mind as they're navigating, the worlds of diabetes medications?
I think the most important thing to remember is that diabetes management is not a destination.
Right.
It's a journey. It's about finding what works best for you, adapting as needed, and working closely with your healthcare team.
I love that. It's not about being perfect. It's about being informed,
Right.
proactive, and advocating for your own health.
Exactly. And it's about having hope. The landscape of diabetes treatment is constantly evolving with new medications and technologies emerging all the time.
Well said. This deep dive has been packed with insights. Hopefully you guys are feeling more knowledgeable and empowered to have those important conversations with your doctor
Yeah.
and make informed decisions about your health.
Knowledge is power. And being informed is the first step towards taking control of your health.
So before we sign off, we want to hear from you guys. What stood out to you in this deep dive? What questions will you be asking your doctor at your next checkup? Share your thoughts in the comments below, and don't forget to like, share, and subscribe to Visions Beyond for more deep dives into the topics that matter most to you.